And then, let's say they get through with the teen years and they're in the workplace. What still medicines, or are they able to, or is behavioral modification able to help them?
When they start working and start getting older, and I start just looking at maybe target symptoms, because usually adults may have one or two. They just, those symptoms, just those targets are just so pronounced. We have to do something. I tend to slack off medicines at that point, because all I'm trying to do is get them to learn to sort of control themselves at that point, because they're not really hyperactive, so they're not causing major problems on the job. They just need to pay slightly more attention to what they're doing and focusing, and maybe prioritizing their whole day and their routine. I tell some guys and women, I say, well, just pick a day where you're going to pay your bills. So, don't pay one bill Monday, one bill Tuesday, one bill. They just get all confused, papers everywhere. Just try to be more organized, and it sort of helps. And then some patients really worry. I make a joke with them, say, just worry between 6 and 7, at night, and they sort of get more organized. They do better without medicines, unless they're just really bad. There are a subgroup of patients that's going to be on medicines for as long as they need to. It could be 20 years. It could be from 20 to 50 or something. And then some sort of cut back and get off.
Well, how do you tell? I can see, like in an adult, it would be pretty difficult to tell if they start having problems with organization and attention on the job, and trouble paying close watch to details. How would you tell that apart from somebody that was developing depression or developing a bipolar or a manic disorder that might have the same thing?
Right, that's a good question, because adults with ADHD symptoms and newly come in with a complaint, they should always have had some problems at age 8, before 8 or 7. If they don't give them a history of problems when they were in the 1st grade or 2nd grade, I really don't consider ADHD, because it should have developed a long time ago. They didn't know the name of it, but it should have been some symptoms in school.
Let me interrupt you for a second. Now, when you say 1st or 2nd grade, is that something they're going to be able to look back and say, you're right, Doc, my teacher used to have to, paddle me or make me have a timeout or whatever? I mean, will they?
Most of the adults that have gone to school and say obtained maybe up to 7th, 6th grade education will tell you they really couldn't catch it in school. They were really slow. They really finished their work. They were the last one to finish a test, the last one to complete a task, which is another classic example. You can't finish tasks on time. Now they're not finishing tasks. They would say, I had problems all the time and everybody missed it. They thought I was slow, and I thought I was slow. If I don't get that history from a patient, it may take me 2 sessions, but if I don't get it, it's really not ADHD, because it just don't develop. You just can't really go without a brain injury from normal synapses, normal brain, to a sub-average brain as an adult, unless you got some kind of degenerative process going on, Parkinson or something. But they don't have that. I just go straight to something else. And the biggest thing is the mood disorders. I go straight to anxiety, depression, dysthymia, maybe bipolar. Because that would be, as an adult, time I would see that anyway.
Because I can see it would be pretty tragic for somebody not to be treated. And like you said, then they go through school and they're really not. I mean, there's nothing wrong with them in terms of how bright they are. But no.
Yes. They could be really angry. If you think about it, at the parents and at the family, because they say, I could have gone to college, I could have done this, someone just treated me. I'm pretty smart, I just got an IQ test, I know I'm smart, but they don't have anything that they feel objective to verify they're smart.
You said something before about behavioral therapy. Just generally, what is that, and then how does it relate to ADHD?
A lot of behaviors would try to get a child, and say, to contain themselves, with rewards, and say, can you do this, can you sit a little bit longer? It's always some kind of something they can really measure. How long can you do this show? How long can you complete a task? Because if a child has to take an exit exam, and say if it's going to last 2 hours, they have to be able to focus for at least 2 hours to finish that test, because otherwise they won't ever pass the exit exam. So they do whatever they have to do to build up the strength and the willpower to get through the test. Now, speaking of tests, I have to make sure they don't have performance anxiety, because a lot of people have performance anxiety. I think I had a little touch of it. It's when you're on the test, you start criticizing yourself on the test when you need to be focusing on the questions, and which is different than ADHD. But it can impair somebody from concentrating and answering the questions correctly. And sometimes they overread the question. They'll say, well, the teacher trying to trick me. All kind of things they do. So behaviors will say, no, they're not trying to trick you. Look at that cognitive distortion. Let's straighten out, just answer the question.
When they're a child, are there things that what can the parents do? You know, you've put them on medicine. What can the parents do to encourage the kid to do, you know, the things they need to do?
Right. I suggest parents don't really force a child to make all A's. I just think just tell a child do the best they can do, and if they're capable, they will make better grades. I'm a big proponent of reading and doing homework with children. You know, maybe doing the math problem first, letting you see them do it, and not be so focused on the answer. I mean, that's the wrong way to do it. Never focus on it. Just focus on the steps to get to the answer, because that's what they need when they take the test, when you're not going to be there with them. Just gentle encouragement is what I recommend.
Yeah, are there any